Welcome back to Academic Insights, Emergency Management, sponsored by American Military University on Federal News Radio, part of the Federal News Network. My guest today is Allison G.S. Knox, an instructor in the Emergency Management and Fire Science departments at American Military University. I'm your moderator, J.J. Green. Allison, again, thank you so much for taking time to be with us today. This has been a great conversation, and I've learned a heck of a lot about your work and about how it benefits us as the general public. Speaking of the public, there are some major public policy issues that are sort of in the hopper that are coming up. Can you give us a sense of what some of those issues might be that we should pay attention to?
Absolutely. One of the big issues in emergency medical services today is recruitment and retention, particularly with volunteer agencies and in rural communities across the country. It is an issue that is particularly complex. It also means that patients may not receive the care that they need in that emergency scenario that they're dealing with. So that's one big policy issue. And the other one is, of course, dealing with active shooters. The public safety world essentially is trying to figure out how to better manage these incidents so they can prevent them from happening. And then, of course, when they do happen, how to better manage a mass casualty incident with so many patients.
What are some of the options, taking these two issues and just kind of drilling down a little bit on both of them, what are some of the options for dealing with the problems in these rural areas? Because I know exactly what you're talking about. People talk in terms of food, about food deserts, where you don't have a lot of fresh foods and fresh food services available to people in some areas. But I would argue that you have areas, part of the rural structure of the country, where you don't have emergency management as populated as it should be in those places, which means people may not, as you say, get the treatment or the help they need in an expeditious way. So what are some of the options, do you think, for dealing with these problems in the rural areas?
Well, I will use the term wicked problem, which is a social science term that we use to explain situations that are so complex that trying to figure out how to fix them is beyond complicated. And even in the different pieces of those issues, those are also complicated. So I think that the rural community issue, particularly where emergency medical services is concerned, is a wicked problem. I think that it's going to take a lot of collaboration between agencies, between levels of government, and then beyond that in the local government with trying to figure out how to recruit new people to come and help, and then also trying to figure out how to retain those individuals, because there are budget issues, budgetary issues at the local level, and then there's also hospital closings, which could make it even more complicated for ambulances, essentially.
Yeah, that's something I've noticed too, is hospital consolidations in some of these places. You have, whereas when, say, we grew up, there was this hospital that was named this hospital. So, but now this hospital is a part of the such and such a hospital network, and it's a part of a much bigger thing, and there are much larger interests at stake as well.
Absolutely.
So I guess the question I would ask you then is this a problem that needs money, or is this money that needs direction? Because is the money there already?
No, I don't believe so. I think it really depends on where you are and what communities do have some money. I think that, while we can certainly throw money at a problem like this, it's very complicated. It's a very complicated social issue that will take not only money, but a lot of thinking for how to appropriately use that money, how to appropriately set up the different bureaucracies, the different, I don't want to say red tape, but the different things that need to be in place to make that particular area effective for emergency medical services. It's a very, very complicated issue.
You've been involved in the Pi Gamma Mu International Honor Society for the social sciences for a while, about a decade, I understand. Is that correct?
Almost, yes.
So what's the experience been like for you being involved in it?
Well, it's been fantastic. I actually started when we had 125 students at the American Military University, that is in Pi Gamma Mu in our chapter, and we've grown to almost 3,000, which is pretty incredible. So I started off as the chapter sponsor, and I was elected a few years ago to join the board of trustees for Pi Gamma Mu. We have chapters all over the world, which is pretty neat. But my experience has been really figuring out how to do an online chapter, which is a little bit tricky. We don't have a campus where we can meet regularly. So I've done it virtually, and I have had students serving from all over the world at the same time, which makes our conference calls interesting. But it's been fantastic. It's been a great opportunity for me, but it's also been a wonderful opportunity to allow students to network among their majors and with other majors.
So that's what I want to ask you about briefly, that opportunity. What else does it give the student the ability to do that they can't do without being in this Honor Society?
Well, first of all, our Honor Society is one of the oldest social science honor societies. It's interdisciplinary. So it does allow students with social science majors at the American Military University to join. And we also require a 3.5 GPA, so they have to be really good at their major and what they're learning. But the other thing that's been wonderful is that, in addition to networking, there have been opportunities with the international organization to present at the convention. We do a convention every 3 years, which is wonderful. We've had students from AMU come to present, several at the different convention locations. We've also had students that have published in the International Social Science Review. And that's been a fantastic opportunity for them because they can really showcase their work, but in a proper journal.
Anything you'd like to add before we go today that I haven't asked you about that you think is important on this topic?
We have a lot of students that will be traveling to Washington, D.C. next year. If they're online and they're not in the Washington, D.C. area, they'll be coming for our triennial convention. I'm hoping that we have a lot of students from our AMU chapter that will be coming and presenting their work.
Awesome. Thank you for being here today.
Well, thank you for having me.
I'd like to thank today's guest, Allison G.S. Knox, an instructor in the Emergency Management and Fire Science departments at American Military University. I'm your moderator, J.J. Green, and you're listening to Federal News Radio, part of the Federal News Network. For more on this discussion, visit federalnewsnetwork.com. Search Academic Insights.